Thank you again so much for joining our webinar today. We're going to start in about 30 seconds. Again, my name is Andre Bailey. I'm the CEO and founder of Project Opioid. Project Opioid is one of the leading advocacy groups in the United States of America on the issue of the opioid crisis. Today, we're going to be filling you in on some important information from top national experts on how the opioid crisis and the greater addiction crisis is impacting our veterans. And I think you as leaders, again, our webinars are invite only to mayors, county leaders, sheriffs, law enforcement, governors, and their staffs. We are a leadership organization, and we think that you're going to have great value today from the information given. We're going to be starting in just a second. Thank you for joining our webinar today. All right, Amber, next slide, please. Again, that's the face of the opioid crisis. Young people dying in record numbers, over 100,000 deaths last year in 2022 alone. And it's uniquely impacting young people and uniquely impacting our veterans. And we're so excited to bring you expertise and knowledge that you can use in your community to impact this issue. Again, I'm Andre Bailey. That's my contact information. That is not an office number. That is my cell phone. If you're a mayor, a county leader, a sheriff, someone who's leading an initiative in your community, in your state around the opioid crisis, that's my number. That's my email. We want to help you. We want to partner with you. That's what Project Opioid exists to do. Next slide, please. A little bit more about who we are. Oh, actually, before I get into that, let me talk about the amazing guests we have today. First of all, Wounded Warrior Project needs no introduction. The most prominent advocacy group in this country around the issues of veterans. John Eaton, their vice president of complex care, is going to be joining us. He's got an amazing presentation. And so we're so excited to have the Wounded Warrior Project as a partner of Project Opioid. And John, we're excited to be talking to you in just a minute. Next slide, please. We're also going to have on one of my personal friends, Brad Rex, president, CEO, eHome, also the founder, eHome Counseling Group. eHome has been pioneering over the last few years some of the most amazing strategies to help veterans who struggle across the board, but especially with this addiction crisis and the mental health crisis driving it. So Brad Rex is amazing, and so excited to be hearing from him shortly. Next slide, please. Also, North Star Care, Dr. Amanda Wilson, CEO and co-founder of North Star Care. Again, one of the top groups in America, helping our veterans get the help they need, the help they deserve. She's going to be talking about many of the most important aspects of how we impact our veterans. And Dr. Amanda Wilson, her contact information, Brad's contact information, all in the chat. So thankful for them. And we're going to be hearing from all of them in just a minute. Next slide, please. Again, our webinar topics: why veterans are more vulnerable to the opioid crisis and all types of substance use disorders, the prevalence of addiction among veterans, challenges and barriers that veterans face, virtual care. We're going to talk about why virtual care, which has exploded since the pandemic in 2020, why it matters and why it can be something incredibly positive for our veterans. We're going to talk about the specific benefits of treatment for veterans. We're going to talk about how to implement programs in your community for veterans struggling with substance use disorder, and then just talk about Project Opioid's next steps in 2024 and beyond. Next slide, please. So let me go quickly, for those of you just learning about Project Opioid, who are we? Again, Project Opioid is a national advocacy group focused on bringing leaders together in communities to address the opioid crisis. We are not just about the what, we're about the who. Your leadership is what matters. Mayor, county leader, sheriff, chief of police, those that work for the leaders of your community. We must see leadership come together at a community level. That's what ultimately can impact the addiction crisis, the opioid crisis, and help veterans. That's what we're all about. We engineer those solutions in communities. If we can help you do that, we'd love to hear from you. Next slide, please. Project Opioid is all about leaders saving lives. Leaders can create solutions. I think, better put, leaders are the solution because they have the power, influence, and resources to make a difference. You are the solution to the addiction crisis, to the opioid crisis for veterans. If you are on this webinar, if you can hear the sound of my voice, you are someone that can make great impact in your community. And we hope today to help you go down the road a little bit further in doing that. 3 things we say you should do in your community. This is the Project Opioid model. Build a coalition, do advocacy, and drive a collective engagement of leaders to resource solutions for the opioid crisis, for the mental health crisis, and in this webinar specifically for veterans. You'll see in our circles here, government is highlighted, but we also believe business, philanthropy, and faith-based organizations are important. Leaders taking action together can make a difference. Mayor, county leader, others in your community, if you're a part of government, one of the most important things you can do, bring the business community, philanthropy, your faith-based organizations to work together. All of you can solve this crisis. Next slide, please. And ultimately, what does a solution look like in your community, whether it's helping veterans, whether it's helping those with the opioid, struggling from opioid addiction, whatever it might be, it looks like you coming together, creating a way that when folks reach out for help, they get help. That's what Project Opioid wants to empower you to do. Next slide, please. So without further ado, we're going to talk later. I'm going to wait till later to talk about this, but we're going to give you, we've got some new data. Dr. Kendall Cortelyou, our data professional, is talking about this. I'll quickly drive through it. Things you need to be looking at for veterans, for the opioid crisis, things you need to know. Number 1, fentanyl still driving this crisis. The opioid crisis is really a fentanyl crisis now. We have moved away from a prescription pill crisis, which was 10 years ago the predominant killer and driver of the opioid crisis, to now illicit fentanyl coming across our border. This is what's killing 85–90% of the people in your community. That's what the focus needs to be. Number 2, the crisis is killing young people at unacceptably high rates. We're seeing more and more young people die. 108,000 of our American citizens, many of them veterans, died last year. It's killing young people at record numbers. Next slide. And also leaders around Florida, where I'm at, and leaders around America, next slide, please, can be a part of this crisis solution. If you have questions as we move into our first presentation, put them in the chat. We have a Q&A, and we'll do our best to answer your questions live. So without further ado, next slide. Project Opioid is so happy to present. John, are you there? Can you hear me?
I can.
Wonderful. Well, John Eaton is Vice President of Complex Care for the Wounded Warrior Project. He is an absolute gem, someone who has been fighting for help for veterans for so long. And he's going to give us an amazing presentation. If you have questions for John, just know you can put those in the chat. At the end of the webinar, we're also going to do a little bit of Q&A with all 3 of our leaders. So John, it's so great to have you here.
Hey, thanks for having me, Andre, and thanks to Project Opioid for hosting such an important topic with so many key leaders. Thank you.
Well, John, our team is handing the steering wheel to you. Take it away.
Great. We can move right on to the next slide then. And thank you all. So as Andre mentioned, my name is John Eaton, and I have the honor of serving as the Vice President for Complex Care at Wounded Warrior Project and leading all of our mental health initiatives across the country. And so today I really want to spend the time giving a brief overview of Wounded Warrior Project, but also really talking a little more deeply about veteran-centric issues and things that we're seeing, both from the mental health and substance use spectrums, and then going into really looking at some of the barriers to care that are unique to veterans, and really hoping that serves as a foundation for the remainder of the presentations today. So about Wounded Warrior Project, in 2003, Wounded Warrior Project started as a grassroots effort that really provided care and comfort items to the hospital bedsides of the first injured service members coming home from conflicts in Iraq and Afghanistan. And as those post-service needs have evolved, so have our programs and services. And so this year we've been honored to celebrate our 20th anniversary, honoring and empowering wounded warriors. And just this week celebrated a milestone of over 200,000 registered alumni, seeing 70 new registrations each day, and provide over 20 in-person events on a daily basis across the country. And so throughout those 20 years, Wounded Warrior Project has been dedicated to our mission of honoring and empowering wounded warriors, offering more than a dozen direct service programs focused on connection, independence, and wellness in every spectrum of a warrior's life. These programs span mental health, physical health, and financial domains that create this 360-degree model of care and support. Our organization has grown alongside of the warriors we serve, and we strive to tailor our programming to the evolving needs of a post 9/11 generation of warriors that have become increasingly diverse. And of course, Wounded Warrior Project believes that no one organization can meet all of the needs of the wounded, ill, and injured veterans alone. And so partnerships with the folks on this call today and investments in other military and veteran support organizations are key in guiding collaboration that allows us to amplify these efforts across the country. Next slide, please. To set the stage today, I'm going to focus on sharing some data that we have collected through Wounded Warrior Project's annual Warrior Survey. So this is the 13th administration of an annual survey that gives veterans a platform to be heard while also providing this 360-degree view of Wounded Warrior Project's warriors that serves us to be able to understand and address many of the needs and how they're evolving, and certainly informs our programming. As you can see by the numbers on this slide, mental health continues to be a focus area and a need for the warriors that we serve, and really a priority organizationally as such, and is our largest program investment as an organization. Just last fiscal year, Wounded Warrior Project spent more than $82 million in mental and brain health programming, which is an investment consistent with the fact that from our annual Warrior Survey, we see that 7 out of 10 respondents report having at least one mental health condition. So 70% of our population. By comparison, in 2020, roughly 21% of US adults experience a mental health condition. So really starts to paint a picture and really understand some of those unique needs that veterans see. Also, we know that veteran mental health conditions make up 3 out of 5 of the top service-related injuries and health issues, which you see highlighted on the bottom left hand of the slide here. Further, when you look at PTSD, anxiety, depression, almost half of all warriors are presenting with moderate to severe symptoms in at least 2 or more of those mental health conditions. And that's important. You'll see in the next slide when we think about just the importance of identifying those co-occurring conditions and the perhaps vulnerability if not supported. In the blue box, I would call your attention to the bottom 2 stats around warriors indicating that they may have unsafe drinking habits or indicating some level of substance use or abuse. These are self-reported from the warriors that we've surveyed, over 200,000. And when we look at that, we start to compare that to 2019 national survey on drug abuse and health, and thinking about across the US, adults 18 and over, roughly 25.8% of people report having engaged in binge drinking over the last month, or 6.3 engaging in heavy alcohol abuse. So when we see this population and what the feedback we're getting, again, really highlights the need and certainly the priority and focus of our investment as an organization. So that relationship between substance use and mental health is very complex. And for some, substance use is a coping mechanism that for dealing with those mental health challenges. And certainly within our Wounded Warrior Project population, we see that it's more than twice as common among those warriors that have 2 or more mental health conditions. Next slide, please. Continuing to really highlight the unique needs that we've seen through our annual Warrior Survey, we saw from this most recent year that warriors rely on very different support mechanisms when it comes to mental health, which really highlights the importance of a supportive community, veteran peer connection, and accessible professional care. The top right is an area where we're gaining a deeper understanding year over year in understanding chronic pain. Issues like chronic pain can take a toll on veterans' ability to fully participate and enjoy life. And given the prevalence of injuries and health problems, chronic pain is certainly a critical concern for our veteran population, with about 3 in 4 warriors scoring on a range indicating that moderate to severe pain level. For a number of reasons, it's concerning that over half of warriors, according to this survey, report that they're managing pain with prescription pain medications. With an opioid epidemic that has touched countless lives across the country, drug overdose mortality rates increasing up to by 53%. This is really a top priority for our investment and the work that we're doing to support veterans. Also, touching on that, and again, we know that these key needs don't operate within a vacuum, and we see that interconnection between mental health, chronic pain, sleep, and also a growing understanding around suicide as well. As a mental health issue, it continues to persist as a top concern among our warriors. And when we look at those stats around the warriors we serve, and that we see the numbers growing, unfortunately, since 2021. So nearly 1 in 5 warriors have had a suicide attempt at least once in their lifetime, and over 1 in 4 have had those thoughts within the past 12 months. So again, as you know, I know this is a lot of information to take at once, but really wanted to give you that high level overview landscape yearly assessment that helps really influence not only the investment we make, but the incredible partnerships that we have, like those in this call. Next slide, please. And just highlighting, and this is not news to anyone on this Zoom today, but really looking at the barriers to care that veterans face when looking to access care. And I'll just highlight a few here when we look at the financial strain that providing that care can cost. But really, even more importantly, is access to care and capacity of providers. Whether it's taking off work to go to a provider because of a time distance, or the lack of capacity creating longer wait times. We know that these are severe barriers for our population and actually lead into some of the outcomes that we see. So from a traditional outpatient provider standpoint, a veteran can expect between 6 weeks and 6 months of a wait for that appointment. From the VA on average, depends upon region, but it could be standard to think about a 45-day turnaround for an appointment if it's not a critical immediate need. And that also results in about a 40% no-show rate. So we know that these are all dynamics that affect, quite frankly, beyond the veteran population, but we see that even more focused in this population. And I do want to just also add a piece of hope as well, because one of the things that's been a really great silver lining of COVID has been the expansion and embracement of telehealth. And our warriors have really leaned into this as well. And it's one of the ways that we can overcome barriers to get the care that they need. And it's very well received. And so for most that have been offered a telehealth appointment, they've utilized it. And even if it wasn't offered, our veterans are really commenting that they're looking for those opportunities. So 89% of veterans offered telehealth have actually accepted that as a delivery model, which is really exciting to think about what that future can bring, and excited about what that does to influence our programming. Final slide, please. And so what you'll see in just highlighting this is 20 years in the making, and this is WWP's mental health continuum of support, ranging from clinical intensive services all the way through to our less clinical and really more supportive and empowering programs. This is really that system of care that we've cultivated and grown throughout the last 20 years. And just a few highlights of why that's important and what it means when we talk about those outpatient provider barriers or delays in care with incredible partners, many of them on this call today, from WWP's outpatient providers. Veterans are linked to a provider in less than 14 days and have that first session in under 30 days. Also transforming the care delivery model for conditions such as post-traumatic stress disorder. What used to take a year of outpatient therapy or a 6 to 9 month residential program is now being delivered in an accelerated treatment model through the Warrior Care Network in either 1 or 2 week in-person or virtual setting. So really just want to, a key takeaway is, yes, the need is great, but really supportive and encouraged by the incredible partnerships and support for veterans, and look forward to building on that in the years to come.
John, thank you so much. I know this is a lot of information. John, you have packed us with facts and data, and thank you for that. For those of you that want these slides, we are going to make them available to you, as well as the full audio and video recording of this Zoom within 24 hours of the webinar. So don't worry if you missed some of what John presented. We're going to be able to present it to you. John, unmute yourself, my friend. When you think about, John, so many community leaders who are on here, we see folks all the way from Florida to Washington to California to New York and everywhere in between. John, a lot of the leaders on this call now have money in their community specifically tied to the opioid settlements. We've been talking about this a lot at Project Opioid. millions and millions of dollars flowing around to some to cities, some to counties, some to states. Every state has a different abatement judgment that dictates how this money is coming. For most states, it's going to be front loaded for 9 years and then 18 total years of money coming and more settlements to come. John, all that to say or to ask you, if you were a community leader, a mayor, a hospital, someone who, a behavioral health center, a county leader, how would you be thinking about taking some of the opioid settlement money and focusing it for veteran related programs? What would your advice be to the communities looking to address the opioid crisis and help veterans?
Yeah, no, thank you for that question, Andre. I think really when it comes down to getting into treatment and providing the support, I think time is of the essence. And so our focus and a priority is really looking at removing barriers to care when a veteran is ready for receiving that treatment, whether regardless of the intervention. Sometimes things that to some might not be barriers, childcare, pet care, internet connection can actually be barriers to care. And so really investing in how we can support those smaller unmet needs, and then investing in leveraging some opportunities around alternative care models. I think we'll hear some of that today, and really helping. This is an opportunity to think about really treatment in a totally different way than we have traditionally done. And so I think it's an exciting time, especially for communities to lead the innovation in those areas.
Got it, John. And we're going to move on in just a second. We'll come back to you later, but I have more of a philosophical question. I know I've gotten some texts about this, and you get this question every day of your life. John, why do veterans struggle uniquely with the opioid crisis or addiction in general? And this is, again, at 10,000 feet, I'm really asking this question. If you are a leader in a community looking to address the opioid crisis, looking to help veterans, looking to address addiction, in a broader sense with veterans, what do you tell someone when they ask why veterans need specific help? What's your answer to that question?
That is a really philosophical question. I think that when we think about it, we're all humans have a lot of interactions they go through out their entire life, and so from the veteran population, whether it's prior to service, during service, or after service, there's always areas that could be addressed and supported. And I think that one piece throughout that for veterans is unique, is a transition. And so at times of transition, at times when you don't have as strong of a support system and a tribe, those are areas that can be vulnerable for anyone, veterans included. And so we really prioritize connection in looking at the impact of loneliness, and those are all really key factors that that contribute uniquely to some of the needs we see among veterans.
Got it. John Eaton is the Vice President of Complex Care for Wounded Warrior Project. If you are out there, screenshot this. Before we move off this slide, Amber, let everyone take a photo of this, screenshot this. This is how you can get a hold of John. Partner with Wounded Warrior Project in your community. They are only a phone call away. John would love to partner with you. They're already working across America, but they need to work with you when as you're putting together your solution for the opioid crisis and for veterans. So John, we'll come back to you in a minute. Thank you so much for that valuable information. Next slide, please. Again, if any questions, put them in the chat. We're so excited to see hundreds and hundreds of leaders on this webinar, but if you have questions, put them in the chat. If you have a question for John, if you have a question for Brad or Amanda, me, any of our team, put it in the chat. We'd love to try to answer that, or we'll get back to you offline with an answer. Next, we want to talk to Brad Rex. Brad, are you there?
I am, Andre.
Brad Rex is a friend. I've known Brad a while. He is a fellow Floridian. He is also the CEO of eHome Counseling Group, an organization, board member of Project Opioid. He's really helped pioneer across America solutions for veterans and for non-veteran populations, using technology and using counseling through Zoom and other platforms. And Brad is also someone who has shown personally a commitment to the fight for veterans and the help that they need. Brad, we're so excited to have you on today. Brad, what part of the country are you in today?
Orlando, Florida.
Orlando, Florida. So Brad, I was actually in Columbus, Ohio on Tuesday. It was a frigid 19 degrees in Columbus, Ohio. Now I'm back in Florida. I think it's going to get down the temperature of about 68 tonight in Florida. So us in the South, we are feeling for you guys in the North right now. But Brad, great to have you on. Next slide, please. Brad, we're going to let you talk about what you're doing at eHome Counseling. I'm going to turn the wheel over to you. Just work with my team. And Brad, when I come back, I'll have some questions for you, because I believe, Brad, let me just turn the wheel over to you by saying this. I think there's still a big conversation about how we use technology to bridge this gap for those needing counseling, those who are struggling with addiction, those who are struggling with the opioid crisis. Brad, before COVID, before the pandemic, I never did a Zoom like this. I was one of those old school. Every meeting has to be in person, and I was wrong. I've told you this before. I was wrong. I think that technology, like what we're using today to work with hundreds of leaders around America, technology can be an incredibly important part of projects like Project Opioid, but more importantly, you've seen how it can be an incredible part in therapy, in the behavioral health treatment, and the mental health treatment for those who are struggling with opioid addiction in general, or our veterans. So we're excited to have you on, and take it away, Brad, my friend.
Great. Well, thank you so much, Andre. And yes, you're exactly right. We're going to talk about technology today. But before we start, I just want to thank the more than 300 leaders, community leaders who are on this call, for your leadership during these challenging times. The fact that you've stepped up and you're willing to serve your constituents, your employees, and most particularly your veterans, means an awful lot. I'm a veteran. I went to the United States Naval Academy. Go Navy, beat Army. And was a nuclear submarine officer. So this is near and dear to my heart. And once again, thank you for that, and to John and Amanda for all you're doing as well. So about 6 years ago, we formed eHome Counseling Group, and we want to do a new approach to mental health care. We are completely virtual. So as Andre said, when COVID hit, a lot of people switched to virtual. We've always been completely virtual. We're nationwide. So we wanted to allow anyone in the country, all 50 states plus DC and Puerto Rico, to be able to get care. And when we formed the company, we said, you know what, we want to know that what we're doing actually works. I was kind of shocked, frankly, when I came into the industry and found out less than 20% of behavioral health providers used any kind of metrics. If you're not using metrics, how do you know if what you're doing works? And so we do something called the M3 assessment, measures 7 different conditions. We do it before the first session and then throughout treatment. So you can actually see, as the client and the counselor, the improvement in your mental health, and then know when you've completed treatment. I'm a former Disney executive. I actually ran Epcot theme park for 5.5 years. And so what I wanted to do with our company was to provide fabulous customer service. And we do that through a Disney trained concierge level white glove client care team. One of the big issues that John mentioned is people finding a counselor. Well, in our situation, our client care team speaks to every person, helps them do their intake online, sends them the assessment, but most importantly, they match them with a counselor that meets their needs. And when you talk to people, they just love that the burden is not on them to find that counselor. You always have somebody to talk to with our client care team with any issues, any problems, and it's really helped differentiate us in the industry. But the one thing I learned at Disney is the most important thing are the people that you hire. And we are very fortunate. We have a very rigorous process to select the A player counselors. There's a huge difference when you're treated with an A counselor versus any other. And with that, we get the best outcomes in the shortest number of sessions. And in particular for our veteran clients who are there many times with fellow veterans, military spouses, with people who understand where they're coming from with their issues. We're in network with all the major payers, so it makes it very easy to get insurance reimbursement for your employees or for veterans or others. And then a couple of things I'm frankly very proud of. we were selected by the U.S. Olympic and Paralympic Committee to be the major primary mental health care provider for Team USA. And when we asked them why, they said, because you guys are the only ones that can prove that what you do actually works. But the most important and best partnership we absolutely have is with Wounded Warrior Project. We've been treating veterans through Wounded Warrior for more than 5 years now. We've treated thousands of veterans, and we were actually selected as the best online therapy for veterans by onlinetherapy.com in 2021. So next slide, please. John mentioned about barriers to care, and I want to just do a little bit deeper dive into that. When you look at it, access to quality care, I can't get an appointment. John mentioned some of the statistics, 6-week average across the US to try to get in to see a counselor. And I believe so strongly in virtual care because we can take care of anyone, anywhere with a counselor that meets their needs. You don't have that geographic constraint of trying to find a counselor near you. Can you believe the statistic that 50% of the US population does not have access to any mental health provider? Not a psychiatrist, not a counselor. And as you might imagine, these are folks who live in rural areas. They don't have counselors near them, 2 to 3 hour drive. The only way we're going to reach those folks is virtually through their laptops, smartphones, tablets. And that's why we're pretty passionate at eHome about virtual care. Stigma. When you do care virtually, nobody needs to know. It's completely private, confidential. You can do it in your home, in your office, wherever you're comfortable. You don't have to go to a counselor's office. You don't have to be in a waiting room. You don't have to check into a rehab facility somewhere. Time away from work and family. People say, look, I can't go to rehab for 30 days. I'd miss work. I'd miss my family. When you do it virtually, it's on your schedule. No need to travel or go anywhere else. The question we get frequently is, well, why be in treatment forever? Well, guess what? When you use metrics-based care, you actually significantly shorten the time in treatment. 88% of our clients complete treatment within 6 months. And so if you think, oh, I'm going to be in therapy for years, that's not the case. How do I know it's going to work? Well, I'm going to show you some statistics. Because we use metrics, we know what works, and we can tell you that this is effective. And then finally, cost. John mentioned this is a big barrier, and people can't spend $500 a day for rehab. Amanda's going to share with you her amazing program, a fraction of the cost and 5 times more effective than what's available today with traditional care. Next slide, please. So because we use metrics, we can actually compare our veteran population to our commercial clients. And so this isn't theoretical. These are absolute hard numbers. What we found is 75% of warriors had severe or moderate scores in 2022 compared to 40% for commercial clients. And look at the severity. Commercial clients, 2% severe, veterans, 9%. So there's absolutely a big difference in taking care of veterans. They have unique needs compared to the civilian population. Next slide, please. If you do a little bit deeper dive, we have it all broken down. As I mentioned, we measure 7 different conditions, including drug use, alcohol use, and suicidality. Well, guess what? Veterans are 2 times more likely to have a drug use issue, 2.4 times for alcohol use, and 3.5 times for suicidality. So we have to have dedicated programs to help our veterans who are struggling with these particular issues. Next slide, please. Drugs and alcohol coincide with suicidality. Again, in our research, what we found is if you have a flag for suicidality, you're 3 times more likely to have a drugs flag, twice as likely to have an alcohol flag. Now, what this tells us is if we can treat veterans for drug and alcohol abuse, we can potentially reduce the suicide rate significantly. We've gone from 17 veterans a year to 17 veterans a day to 17 and a half veterans a day who are committing suicide. We've got to fix this. In society today, the latest numbers came out, 50,000 Americans took their lives by suicide. If we can reduce drug and alcohol use, we can reduce suicide. Next slide, please. Here's the good news. I've kind of given you, oh my gosh, all the bad news. The good news is treatment works, even for severe conditions. The warriors that we treated, the veterans, 72% showed improvement in total score with treatment. And not only that, but when they improved significantly. They dropped in their risk categories, severe to moderate, moderate to mild to no low. And what we consider our real success stories are people who came in who were moderate or severe in mental health condition and went down to mild or no low. And we see that happen every single day. So if we can get people into treatment, treatment works, and we can dramatically improve lives. Next slide, please. Alcohol, drug, and suicidality are also all reduced through therapy. And you can see here 70%, 74%, 64% showed improvement. And once again, when they did, they dramatically improved. So by getting our veterans into treatment, we can reduce these situations and hopefully save lives and change lives. Next slide, please. So a very interesting thing, John mentioned PTSD. PTSD is very prevalent today. It's not just a veteran issue. COVID was traumatic for our entire population. And what we have found is that if you treat PTSD, you can actually significantly reduce drug and alcohol use. If you think about it, people who are struggling from having experienced a traumatic event are self-medicating with drugs and with alcohol. So if you can help them to overcome that event through treatment, they can actually not become addicted or dramatically reduce their usage. We have a virtual PTSD program that is actually Cigna's virtual center of excellence for PTSD treatment. 12 weeks long, it can make a dramatic impact, dramatic reduction in PTSD. And once again, completely confidential and private. So you don't have to worry about stigma. But I would encourage all of you who have employees, who are constituencies, and in particular veterans, let's treat PTSD, and then we can hopefully get a head start on treating addiction. Next slide, please. So key takeaways. Virtual care removes barriers. I would submit to you that the only solution we've got to the opioid epidemic is virtual care. We cannot build enough physical facilities. And even if we could, we cannot get the counselors to move to those facilities to cover all the needs in the US. So providing high quality virtual care is going to take us a long way to solving this issue. Veterans have unique mental health needs, almost twice the civilian population. So let's focus on and help them. If we can reduce drug use and alcohol use, we can reduce suicidality. I've lost a good friend to suicide. I can tell you the impact on his family, community, friends, it's dramatic. And every life we save is important. The good news, treatment works. Let's get people into care. Let's get them what they need, and we can make an impact here. Treating PTSD reduces drug and alcohol use. If we can keep people from getting addicted, we can really help to stop this problem. And then the final is, look, all of you on this call, the more than 300 people, you can make a difference. You're the leaders in your communities who can get engaged with organizations like Wounded Warrior, with us, with Amanda Wilson's North Star Care. And being a former Disney exec, I got to close with a story. And so we had a counselor who shared this. He was treating a veteran, and the veteran said, we started the session, the veteran said, can you excuse me for a minute? And the counselor said, yes, of course. And so the veteran left the room, came back in with his 2 young sons. And he put his boys on his lap and said, boys, I'd like you to meet Mr. Brandon. I know I have not been the father I should have been for you, but Mr. Brandon is helping me to become the father I want to be for you. And I share that story because when we help a veteran, you're not only helping that veteran, you're impacting their spouse, you're impacting their children. And if you think about the legacy impact of that, those kids who are growing up in a healthy household with a healthy dad, they're going to have a healthy family later. So you have the opportunity today to impact that veteran, to impact that family, and make a generational impact.
Brad, thank you so much. Brad, before you go, I've got a couple questions here. I want to ask you, Brad Rex, such a great presentation. Brad, Michael Howard is asking, what is the success rate for virtual care versus in-person outpatient or residential treatment? And by the way, that probably depends on what type of care, but what are you seeing as far as the comparison?
Awesome question. You know, we get this frequently. Even just this morning, I read a study on this, and across the board, what we're finding is that virtual care is equal to or more effective than in-person care. You know, John mentioned a 40% no-show rate for in-person care. With virtual care, we have less than a 10% no-show rate. People actually come to their sessions, they complete the sessions, they complete their treatment, and they get better. And so, yes, across the board, we've shown this in addiction, in numerous different. Now, there are clearly situations where people require a much higher level of care, very complex care, and serious mental illness. But for the majority of the people, we can take care of them virtually, and they can get the care that they need.
Great answer, Brad. We have multiple questions for you, but I'm gonna just pick one more. Tracy Bryant is asking a question. I'm gonna give my feedback on the question, then let you answer this as we go on to Amanda's presentation. Tracy Bryant asked, do veterans need particular recovery care because of specific types of trauma they suffered in war, in their service? Brad, let me say this, and then I'm gonna give you the last word, and we're gonna move on. My grandfather, I'm 47 years old, and my grandfather, when he was 17, he lied on his paperwork to join the Marine Corps, to enter into the Great War of World War II, and within 3 months found himself a gunner on a tank, on the Japanese front. And as I heard these stories growing up, was part of fighting for our freedom, and was part of the most amazing group of Americans that fought and defeated the Germans and the Japanese, and the Axis power, saved really the world. He was a true wounded warrior hero. But Brad, he came back and he was never the same. He had seen horrific things, and this is the 50s and 60s where you didn't talk about these types of problems at all. I saw personally how my father was impacted by my grandfather's trauma. I saw how my father's challenges impacted me. What do you say to those who might know a veteran, who, whether it was through service, direct combat, or whatever it might be? What do you say to someone as far as how that impact can impact someone's life, a veteran's life, and then the hope for the future beyond that?
Absolutely. Well, Tracy, great question. And Andre, thanks for sharing your personal story. We can help that type of person who's struggling that way. Wounded Warriors available, completely free care available to veterans. Reach out to Wounded Warrior, they can do it. But one of the specific things that we found is very important is having counselors who are familiar with the military culturization. Same thing with first responders. They've seen things that civilians have not seen. And so you have to have counselors who understand that, who understand the lingo. Again, Wounded Warrior puts a lot of emphasis on military acculturation for the counselors that treat the warriors. So when you can do that and make that strong connection, you can really help people and get them better and have a generational impact.
Great answer, Brad. That if we're looking to help our veterans, really it's about having a culture that understands veterans as a starting point. And I love that. Brad Rex, please take a screenshot of this information right now so you can get a hold of Brad Rex. He is the CEO, board member of Project Opioid, but the CEO of eHome Counseling Group. Brad, thank you so much. Don't go away. We might try to come back to you. We've got about 16 minutes left. Next slide, please. If you have any questions, keep putting them in the chat. We're so excited about you joining us today. But now our final presenter, because we are ending in 16 minutes. We are always good at honoring your time is Amanda Wilson. She is the CEO and co-founder of North Star Care. This is her information. You're going to be wanting to get a hold of her afterward. But so take a screenshot of this right now. Amanda, are you there? Amanda Wilson, doing a technology check. Amanda, are you there?
Yes, I'm here now. Can you hear me?
I can. There we go.
Thank
See,
you, Andre.
technology is our friend until it isn't, right? So,
You never
Amanda,
know.
we're gonna turn the wheel over to you and try to leave a couple minutes for questions. But Amanda, why are you? Next slide, please. Amanda, as you get into your presentation, why are you passionate about this issue? Why are you passionate about the opioid crisis, the addiction crisis, and how it impacts not just veterans, but everyone? Why are you passionate about this, Amanda? And take it away.
Sure. Thank you so much, Andre. Thank you all for inviting me to participate today. It's just a true honor to be alongside, Brad Rex and John Eaton with their long experience and their history and their service. So thank you so much. In terms of my passion and where that comes from, I'm an internist, I'm an addiction doctor, and going back in 2008, 2009, when the opioid epidemic was crescending and people did not really know about it yet, it really wasn't publicly at top of the news. I think at that point I was seeing it in my own community where I was working in a hospital setting, and really disturbed by how many people were getting admitted and readmitted to the hospital with problems that were as a result of opioid dependence. So I began researching it in my own community, trying to understand where could we make a difference, what could change these outcomes. And I began a small program in Western Massachusetts, actually, to launch care for patients with opioid use disorder and try to do that care in a unique and different way. And I was really passionate about getting care to the underserved. At that time, the only people who were able to access medication treatments for opioid use disorder actually were people who had commercial insurance or who could pay cash. I wanted to get care to people who were minorities, to people who were underserved, to our Medicaid beneficiaries and recipients. So we opened the door broadly and widely in my first company. If you could go on to the next slide. My first company was Clean Slate, and it was really the very first opioid use disorder treatment program in the country to be physician-led in individual offices spread all around the country. That company has now treated over 110,000 patients because the need was so great. So I'm very passionate about increasing access to care. And what I learned, interestingly, from creating Clean Slate, which was multiple clinics, was that in Massachusetts, where I originally thought maybe 5 clinics would be enough, it's a relatively small state, I learned quickly that actually expanding was necessary. We ended up with 17 clinics just across Massachusetts because of the challenges of getting people to care. And so I started looking at ways to think about how could we get care to the patients instead of always bringing the patients to the care. And so I'd like to echo what Brad shared earlier, that virtual care, I think, is a huge potential solution for this crisis. In 2017, before the opioid crisis, before telehealth was really widely used or known, I began a company called Boulder Care, which was the very first telehealth program led by physicians, again, to use medication treatment to provide access to care to patients with opioid use disorder. And that company's treated about 20,000 patients so far. So between the two, it's become a real clear thing to me that the need for care and the access to care continues to not to be there, even with as many companies as there are out there doing this. There's just far too many people that need this care, and we have to bring it to them. So the company that I'm working on building right now and that's growing is called North Star Care. The focus there, again, is novel use of technology and novel use of different science to try to approach this in a very innovative way. And why don't we go to the next slide and we can begin talking about how we approach addiction in this company. I just want to touch briefly on the fact that traditional care today, right, for many people still consists of going away for treatment, as Brad shared, right? People go away for 30 days and they're leaving their family and their children. They have to leave their work. It's quite disruptive. And I think even more importantly, it's so vulnerable. People have to go away and they have to, essentially be in front of a large group of people they don't know and share a lot of things about themselves that are very personal. And that can be really scary and overwhelming. The advantage of bringing care into the home is that you are making it much easier for people to feel safe. Anonymity is secure and assured. and the patients only then interacting directly with the people that they're talking with. The other advantage I would say is that the providers have the opportunity to really see what's happening in that person's home and be with them on a more day-to-day basis, understanding on a day-to-day basis what the stressors are that people are experiencing. So for our veterans in particular, knowing what's happening in their home life, knowing what's happening in their family life, understanding those things actually, I think, dramatically improve our ability to be more effective in patient care. So we took a real deep dive in the science and really spent a year and a half trying to understand what components of treatment would dramatically improve clinical outcomes. And we looked at 6 core things that clearly drove clinical improvement, and they were medication treatment, actually using nutrient therapies to improve brain health, utilizing peer support, which I think is, unfortunately widely underutilized and can be so important to clinical outcomes, genetic testing to help us determine which medications are going to work best for which patients, care coordination to make this care very seamless for patients. That's a huge impact, has a huge impact on challenging access to care for our veterans and warriors. And then the ability to do remote monitoring so that we don't, again, have to have people always going to get these kinds of evaluations, but instead we can evaluate them in the safety of their own home. These disorders, addiction in particular, is a medical disorder. This is not a purely a thing of weakness or, where someone has got moral ineptitude of some type. This really is a medical crisis, and it needs to be addressed in that way. Next slide, please. So we've already touched on many statistics already today. John shared so many really helpful ones. I just want to mention a couple of, I think, really important things. The first I'll just say is that there's a 40% now lifetime incidence of alcohol use, particularly in veterans. And I bring up alcohol use in the context of this discussion that is focused on opioid use, because quite frankly, our veterans are suffering from polysubstance use much of the time. They're very commonly suffering from alcohol use. They're very commonly suffering from opioid use, and many of them together. And so, we can't really separate these things. We also can't separate out the comorbid psychiatric illness that Brad was talking about. We can't separate out the PTSD, the depression, the anxiety, the sleep disturbance. All of these things contribute to people using substances to self-medicate. And so we have to be really mindful about looking at that whole continuum when we're caring for patients with these challenges. Next slide. I'd like to talk a little bit about the brain disease of addiction, because I think it's really, a picture tells 1,000 words. And I think it's really imperative to understand that if we don't address this brain disease medically, we're actually not going to have the same clinical success that is possible. If you look at the brain picture on the left side, this represents a PET CAT scan. It's actually showing you what brain activity looks like. And that's what normal brain activity looks like, with the red areas being areas with high firing. If you look in the middle, that's what the brain looks like of a patient who just went through detox, for example. So perhaps 10 days ago or so, they abruptly stopped using any substance. It looks like this, whether it's opioids or alcohol, interestingly. And if you look at the brain on the right, that's even 100 days out. You can see just how diminished the activity is and how slow it is to return. Even at 100 days, you've got maybe 10 or 15% of normal function. We're asking people during this period of time, this, say 30 to 90 day period, to be successful in abstaining from those substances when their brain is functioning like this. We're asking them to learn life skills and tools that will help them make good decisions when their frontal lobes really aren't functioning at all. And that's where learning happens. So I think if we don't do things to accelerate brain health and to help people be able to use something to help them get through this period of time until their brain function is restored, we can't expect that they're going to have great outcomes. And in fact, that's what we see in treatment today. Next slide. So when we did this very deep dive in the literature, it was really interesting to learn. We looked at 2,600 papers. Actually, we read every publication in the science on alcohol use and opioid use that has been published since the year 2000. Those 2,600 papers told us really interesting things. The first was that, interestingly, there are over 30 medications that are available for the treatment of opioid use and alcohol use. And so we have a wide variety of options that we can pick from and that we can use selectively and personalize the care for each individual patient based on their other needs. We can address nutrient repletion so we can restore that brain health that you saw in the last slide. Doing that makes a huge impact. Patients think clearer very quickly. They feel better. They sleep better. Their cravings go down. So aggressive nutrient repletion, which has long been known to be a need, is really not being done in treatment yet today. And it has such a dramatic impact on patients' outcomes. The third thing that we learned that was really interesting is how much genetics impact treatment outcomes. Genetics not only tell us why someone was at risk for developing this disorder in the first place, and interestingly, we know that at least 50% of the risk of someone developing this problem is because of genetics. It also can tell us, though, which medications and which nutrient therapies will work specifically for that patient. We look at 450 different genome alleles to determine what exactly the treatment should be for any one patient. Next slide, please. So you're probably all familiar with these three medications. Suboxone, of course, the other name is buprenorphine, very widely used today for opioid treatment. Methadone has been around since the 50s, really, and is widely used also, but a little bit more difficult for people to access because of the structure and the way that methadone is dispensed. So that was the advantage of buprenorphine, is being able to actually just get a prescription and get treatment. And then lastly, naltrexone, which is a medication that actually blocks the opioid receptor and diminishes cravings. And I'll mention this because I think this is a really interesting fact about naltrexone. Again, a place where genetics dramatically can change whether you would choose that medication or not. Interestingly, 40% of people in our country, their genome shows that naltrexone won't work for them. So when they take it, it basically is a placebo. It's having no effect. And so that's super unfortunate that it's being so widely prescribed, and yet people aren't getting those genetics first to know whether or not that medication even will be successful for that patient or not. Far few patients are getting medication treatment as it is. We need to increase access, and it's super important to be doing that in conjunction with using other therapeutic modalities like those that Brad talked about. Next slide, please. I think that interdisciplinary comprehensive care really should be how we approach this chronic medical illness. It's how we address all medical illness, right? If someone has an oncology problem, they would go to an oncology doctor. They would also probably see a nurse practitioner and a nurse. They very probably would have a counselor to help them cope with the stress of that. They might be advised to participate in a peer group of other people who also are struggling with cancer. People don't see that the mainstay of treatment is just that support group. They think that the entire program is actually the treatment. And that's how we approach this, with physicians, nurses, nurse practitioners, therapists, peer guides, all working together as a team with a navigator to help coordinate all of that care across the systems. Again, virtual care, I can't emphasize enough, and I agree completely with Brad, I think is the solution to getting treatment to people. If 50% of people today have no access whatsoever, we need to be bringing this treatment to people in their homes instead of trying to bring the patients to the treatment. We can do that using applications like we've built here, for example, so that people can do their video visits right through their phone. They can also track their progress. These things kind of really help to motivate people as they're in this treatment program. Next slide. Leveraging technologies like Zoom and using telehealth, for example, are how we can have the doctors and nurses and everyone interact with patients. But we are doing something quite novel that I'm excited to share with virtual reality. Next slide. We decided to use virtual reality to enable people to come together in groups. We know how important it is for people to come together and to support one another. And by doing it this way, we can actually bring veterans together so they can continue to support each other. And to be able to do that, across the country, we can bring groups together, for example, of veterans that are Iraqi veterans or that are Vietnam veterans, for example, all together. I'm going to actually have you go to my last slide, if you would, just given the time. So I want to just touch, back to that one. Thank you. That's the one. I just want to touch on some take-home, things to share. In terms of success rate, one of the questions earlier, I'll share that our success rate with treating patients at North Star is actually 94.3%. That's compared with the success rate of rehab and detox, which are currently at 10 and 13%. So in other words, using these medication treatments, using this comprehensive approach, we can change the game and improve the outcomes by 8-fold over what the care that's offered today is doing. And I want to bring up a couple of topics that I think are important as takeaways. You have the potential to raise community awareness, using the funds that you're using from the settlement, removing copays, improving Wi-Fi access for people so they can get this virtual care, providing financial support so they can use contingency management as a way to motivate people to engage in care and continue that engagement, removing stigma. All of these things in community engagement can make a huge difference in terms of improving access. So thanks so much for your time, and I appreciate the opportunity to speak with you today.
Amanda, you are amazing. Thank you so much. This is her information. We've got about 60 seconds left. As we wrap up the webinar, just never enough time on these, but we want you to know, number one, we're going to get you connected with Brad, John, and Amanda. Their organizations can be a great help to you as you look to address the opioid crisis, the addiction crisis, and help veterans. Next slide, Amber. You can go all the way to the end. But Project Opioid, we're here to help you. We're gonna talk about some of these things later. We don't have time to do it now, but know this, that through the partnership with organizations like we have heard from today, you can address this crisis in your community. All of you, this is our information. Contact us. Amanda, thank you so much for what you're doing. John, thank you so much for what you're doing. And Brad, all the work that eHome is doing. You can help impact veterans in your community. Be on the lookout for an email in the next 24 hours with ways of connecting with Amanda, connecting with John, and connecting with Brad. And as the CEO and founder of Project Opioid, we're just so thankful for all of you for what you're doing to address this addiction crisis impacting veterans and impacting all of us. Thank you so much. We will see you again in January with our next webinar. Talk to you soon. Thank you, and have a great holiday season.
Bye.